Hi, I'm Brenda Zosa, and I'm a surgeon in the Division of Minimally Invasive Surgery here at Johns Hopkins. I specialize in minimally invasive approaches to upper intestinal disorders, such as acid reflux, hiatal hernias, achalasia, as well as gastroparesis. I'm able to offer both endoscopic and laparoscopic options to treat many of these conditions. I also specialize in treating abdominal and groin hernias. I'm interested in quality improvement and surgical outcomes research when it comes to minimally invasive approaches for both foregut and hernia disorders, as well as addressing healthcare disparities when it comes to access to surgical care. I entered this field because I really enjoy taking care of patients and improving their quality of life. I chose to specialize in minimally invasive surgery so that I could offer patients the best operation for them that leads to a quicker recovery and less pain. I pride myself in taking an individualized and tailored approach to each patient that I meet. I like to take my time and make sure that I fully educate the patient on their condition and the options out there to treat them. Then together, as a team, deciding on the best course of action.